These are not close calls. These are highly popular with the public. And this is one of those cases where doing the right thing is popular. And I wish that Democrats would say, we're going to do this now.
Senator John Marty on pay disparity and health care. He's got solutions. Now on Democratic Visions, here's Tim O'Brien.
We are especially privileged to have the distinguished State Senator John Marty join us. John represents Senate District 66, which is northern St. Paul, Roseville, Lauderdale, and Falcon Heights. John, over the years, has been a stalwart voice for all citizens, with particular emphasis on the middle class and the disadvantaged. John has been a hard advocate for environmental issues, health care reform, campaign finance, and government ethics. John, welcome to the program.
Glad to be here, Tim.
I'm going to take a moment of personal privilege, and I want to note for our audience, this is the 20th anniversary of the date, the year, that you received the Democratic nomination for governor, 1994, as I believe. And the reason I remember that is because I happened to be chairing the convention when we read the results and you received the endorsement. So you ran a good campaign. Elections come and go for various reasons, but you were a great candidate.
Thank you. It was so long ago, and it was not a great year for Democrats, but we moved on.
John, I want to zero in on some of the legislative issues and programs that are before the legislature, and I want to start with a very important bill that you're carrying, which is the Worker Dignity Bill. Can you give us a little bit of background on that bill?
Well, first of all, I think I use the title Worker Dignity because I think all work has dignity and workers ought to be treated with the respect that those jobs deserve. And the biggest thing that isn't dignified about a lot of our jobs is the fact that we don't pay workers enough. And when we get in...
But we just raised the minimum wage.
We raised the minimum wage. So we made, that's actually the first step we made in a number of years. But what I guess I'd say is when we fight over minimum wage or we fight over other policies related to workers and their fair treatment of workers, you know, we forget the big picture of where they are right now. And we have 1 in 3 Minnesota kids are living in households that are in poverty. I think overall, of all Minnesota households, 1 in 10 has times during the year when they don't have money to put food on the table. A national polling firm did a poll about 15 years ago on this, and 94%, a virtual consensus of the public, said they agreed with the statement that somebody who's working full-time should have enough of an income that they don't have to be struggling to put food on the table, that they have basic necessities. And yet we have people who go from their job to a homeless shelter at night because they can't afford housing. So it seems to me that in all our debates at the Capitol, we're missing what's going on, and that
the real world.
The real world, and the public gets that. They think it's simple fairness that somebody who's working shouldn't be struggling to the point they can't pay for necessities. So I'm saying let's start moving forward. About probably 2007, 2008, I was a co-chair of what was called the Legislative Commission on Ending Poverty in Minnesota by the year 2020. An ambitious goal, bipartisan commission. Everybody said, yeah, we ought to try and do this. They mapped out how we could try and end poverty by 2020. Well, we're now halfway between that year when that report came out in the year 2020. And other than the minimum wage increase last year, we've virtually done nothing to address it, and the problem hasn't gotten better. So this bill is saying, hey, we better start acting now if we want to take this thing seriously.
Okay, we started on minimum wage, or I interjected minimum wage. Where do you want to take the minimum wage to, and over what period of time?
Okay. What I want to say, first of all, is I don't think we need a radical shift in something here. I mean, it wouldn't be a bad idea for the workers' sake. But I can understand a small business saying, hey, we can't pay that kind of wages right now. And, you know, some people say it shouldn't be the employers, they're already hard hit, somebody else has to take care of it. And the Poverty Commission basically said there are 2 ways you can take care of the needs of low-income workers. 1, pay them a decent wage, or 2, find other ways to help them get the income necessary to pay the bills. Well, this bill sort of balances those things. It would take our minimum wage increase, which we're phasing in gradually. It went up to $8 this year, $9 next July. This July it'll go up to $9, and then a year later up to $9.50. And I'm saying let's continue that gradual increase with a 75-cent an hour increase in 2017, 18, 19, and 20. So by the year 2020, we'd have a $12.50 an hour minimum wage. It's a lot higher than it is now. It's not a living wage, but if you look at that first of all, it's not radical. It's where we were in the 1960s if you inflation adjusted it. So $12.50 an hour would be the minimum wage. We also have other ways.
Would that be inflation adjusted?
That would be after that, it would be inflation adjusted. So $12.50, so we want to keep it there. We get it to a decent level and we keep it there.
Okay.
And then the second part of it would be, because again, as I said, we're not expecting businesses to do all the heavy lifting here, but we have something that's had strong bipartisan support, what's called at the national level, it's the Earned Income Tax Credit. At the state level, we have a similar Working Family Tax Credit, which basically takes low-income workers and gives them a tax credit on their earnings. So in effect, instead of paying a large income tax, they're getting some back. And it makes a huge difference. This bill would increase it so a single parent, a mom with one child, who makes about $23,000 a year, which is about what you'd be making at $12.50 an hour. As a single parent with one kid at that level would be getting right now under our Minnesota Working Family Credit about 900 some bucks. Under this bill, it would raise it to $3,000. So a $2,000 bump for their income there. So that's two of the things it would do. It would raise the minimum wage significantly, but gradually. It would raise the Earned Income Tax Credit, which is a state expense, but it's a tax cut, and I think it's one there's been bipartisan support for. And the third thing it does is recognize that we don't address child care costs very well. You know, in the 1950s, the Leave It to Beaver type of American family, you know, it was one parent was working, other parents stayed home with the kids. Well, it doesn't work that way anymore. You can't afford to have one person working in a household. So we have lots of single parent households. So you got to do something about child care. And many low income workers, would pay more in child care than they get paid for their work. So we have a program already in Minnesota, the Child Care Assistance Program. The more you make, the more you pay for your child care. It's a great program, but it's not funded enough. So there's a 7,000 family waiting list right now. And it also doesn't reimburse enough. So what I'd suggest we do is, first of all, we fund it so there's no waiting list. So if you are looking for a job, you find a job, you don't have to go tell your employer. The employer says, when can you start? And you say, well,
Exactly.
2-year waiting list.
Right.
So you could start right away. And on top of that, it would reimburse at a decent level. 3/4 is 75th percentile of what local child care providers are getting. So we're not starving the child care providers either. Between those three things, I would argue if you do that, plus you do some universal health care, you wouldn't have working families in poverty. They're not going to be rich, but they at least would be able to put a roof over their heads. They'd be able to pay for decent clothing, for food, for all the costs a typical household has. And I'm saying 94% of Americans believe that working people should not be living in poverty. And we want to address that, and this bill would do that.
But what do you do about the people that can't even work full time? Do they fit into this bill in some fashion or another?
Sure.
The person that their employer won't give them 40 hours a week,
Right.
30 hours a week, 24 hours a week. What happens then?
We're trying a couple of things. And this bill is not a cure-all. This was trying to say we're going to try and get those full-time workers. It does one thing that I didn't mention, which is a program to try and get employers to offer full-time jobs to unemployed folks. And it's a program, it was actually in place in the 1980s during a recession. Mike Freeman and others pushed this great program called the MEAD program, Minnesota Emergency Employment something program. And what it did was, it was something small businesses really like, because there wasn't a lot of red tape. You hire an employee, in this case you hire them making at least $12 an hour, which would be, our minimum wage would eventually push that up beyond that, but you'd pay them $12 an hour, and half of that, whatever you're paying them, up to $12 an hour, $6 of that would be subsidized with a tax credit for the employer for the first 6 months. If you keep them on longer than that, you could get an extra $2 an hour for the rest of the year. And then after that, if you keep them on, you don't have to repay any of it. It was a simple program. It worked well. We think we should reinstate that to help get more jobs for people.
Here's my second question, John. What's happening at the legislature? Do you think that bill of yours has any reasonable prospect of being adopted?
I would predict it's not going to pass this year. What I'm trying to do is we got to get talking about this.
It's a dialogue.
Yeah.
These things happen after some period of time.
And Tim, as I said, 60% is a landslide in politics. This is 94% of the public believes that. And to people who say, oh, I don't trust your poll, go ask your neighbors. What about the employers who are the people who are struggling in other ways? Let's take the sick leave bill. I'm saying the DFL Senate ought to pass that bill this year. If the House won't take it up, I understand, but we ought to be pushing it and saying this is what we believe.
Right.
Some people are afraid, oh, that might be a tough vote. And I'm saying, that one, yeah, I've seen a poll on the paid sick leave bill for employers having to pay low-income workers with some sick time. And yeah, there's only 60% of Republicans supporting that one. It's 83% overall. These are not close calls. These are highly popular with the public. And this is one of those cases where doing the right thing is popular. And I wish that Democrats would say, we're going to do this now. We've got to do it. It's fairness to do it. And so I'm really pleased that, some of my colleagues are pushing this bill for paid sick leave for people. And it's not just for the low-income workers either.
John, in my introductory remarks, I also noted that you're a issue-oriented healthcare reformer. Now, I think everybody in our audience knows that you're a single payer. You've always been a single payer. We don't have a single payer system in Minnesota. Are you still pushing for that?
What I've been arguing in the MNsure and the Affordable Care Act covered a lot of people who didn't have any coverage before, and that's really important. Convoluted, complicated system, it is bureaucratic. It basically is doing more of what we did in the past. We're just doing more of it for more people, and that's a positive thing. We cover more people. But to me, the trouble is it doesn't save money. It covers more people, and that keeps people healthier, and that's a good thing to do. But we can save money, and if we look at the evidence, I don't use the term single payer for what I'm for much, not because I'm opposed to the term, but because most people don't know what it is. They know they love it or they hate it, but they don't know what it is.
So what term would you use?
I just talk about a health care program that covers everyone. I want to deliver health care instead of health insurance. And I'd suggest that one of the problems we've had in public policy, and not just in healthcare, but healthcare is a good example of it, is we see a problem. In our healthcare system, I can name 2 problems that the Affordable Care Act was aimed at addressing, that every reform I've seen in Minnesota aimed at addressing. That's healthcare is too expensive, we got to bring down costs. Not everybody's covered, we got to cover more people. And the biggest one we figure, well, if we bring down costs, more people can get covered. So the biggest effort of all the reforms in recent years has been, how can we bring down the costs? I'm saying, why don't we, for a minute, throw that all aside, just temporarily set that aside and say, look, if we're going to do some reform here, why don't we first figure out how we can deliver health care in a system that keeps people as healthy as possible and gets them the health care they need when they're sick or whatever. How can we design a good health care system that works? Forget about the cost for a minute. We're spending twice what any other country in the world practically is spending. And why don't we just forget about the cost for a minute, because what we're doing isn't working, and try and design a healthcare system that works. And the interesting thing is when you do that, I think coincidentally, you actually save money.
It's interesting.
And that's what we're trying to do. And so what we've got is what we're calling a Minnesota Health Plan, which would cover every Minnesotan, not 90, we got 95% covered now. That's the highest we've ever had. 95% covered, but this would move it up to 100%. And unlike the current system, it's not a problem. The current system isn't just a problem for that 5%. It's the other 95% who are covered, but their copays are too high, or it doesn't include dental care, or it doesn't cover this, and so on.
John, I want to thank you very much for being with us tonight, and particularly thank you for taking a lead on so many important issues. Thanks.
Well, Tim, it's great to be here again.
Democratic Visions is independently crafted by volunteers, mostly Democrats, from Eden Prairie, Minnetonka, Edina, and Bloomington.